Looking for a fast-charging, ultra-responsive stylus for your iPad? Meet the 2X Fast Charge Active Stylus Pen, designed for 2018 to 2025 Apple iPads. Take your creativity and productivity to the next level. Click the link in the video description to shop now on Amazon.
Number of women referred to NHS sexual assault centers rises 18% in 2 years. The number of people being referred for specialist NHS support after rape or sexual assault has increased by nearly 18% in the last 2 years, new NHS data has revealed. NHS sexual assault referral centers provide free specialist support to anyone across England who has been raped, sexually assaulted, or abused. In 2024, they received 26,374 referrals, compared with 22,407 referrals in 2022, NHS England said. The rise follows campaigns by the NHS to ensure more people are aware of the medical, practical, and emotional support available, and to raise awareness of the rollout of sexual assault referral centers, SARCs, among GPs. Services offered by the centers include crisis care, medical and forensic examinations, emergency contraception, and testing for sexually transmitted infections. They can also arrange access to an independent sexual assault advisor and referrals to mental health support and voluntary sector sexual violence support services. While the majority of referrals are for women and girls, these services are available for everyone, regardless of age, gender identity, or sexuality. NHS data indicates that 61% of all service users last year were under the age of 25, with about 7,000 referrals, 27% being made for children under the age of 15. While more people are now accessing support, levels of self-referrals remain low, with the majority of referrals, 78%, coming via the police, suggesting many people may not realize they can seek NHS support without going to the police if they wish, NHS England added. The NHS is urging GPs to help ensure patients know that they can contact an SARC 24 hours a day, 7 days a week, for help, and receive support anonymously if they wish to. On November 25, 2024, Metro launched This Is Not Right, a year-long campaign to address the relentless epidemic of violence against women. Throughout the year, we will be bringing you stories that shine a light on the sheer scale of the epidemic. With the help of our partners at Women's Aid, This Is Not Right aims to engage and empower our readers on the issue of violence against women. You can find more articles here, and if you want to share your story with us, you can send us an email at va@metro.co.uk. Read more. NHS Chief Executive Amanda Pritchard visited the Havens SARC at King's College Hospital in Camberwell to mark International Women's Day, and said, "This is one of those NHS services we all wish didn't need to exist, but as long as there are people who need the specialist care they provide, we are determined to ensure that they can get it. It's encouraging that thousands more people are now accessing support, but there is still more to do to ensure everyone affected knows of the vital care available. This International Women's Day, we want every survivor to know that the NHS is here for you and that free and confidential support is available. Please seek help from one of our centers by visiting Help After Rape and Sexual Assault." Dr. Bernadette Butler, a forensic physician and clinical education and training lead at the Havens in London, and president of the Faculty of Forensic and Legal Medicine, FFLM, added, "The Havens provide a vitally important service for anyone who has been raped or sexually assaulted. Acts of sexual violence can be devastating, and the increase we've seen in referrals is evidence that there is greater awareness of sexual assault referral centers and the care which our teams provide. This is a positive change because the range of holistic care we provide covers the therapeutic aspects of immediate advice on safety, medical care, and crisis support, as well as forensic medical examinations. In addition, there is ongoing care and support from counselors, psychologists, and independent sexual violence advocates or advisors. If you have recently been raped and you are still at risk, ring 999 and ask for the police. Otherwise, the first step is to go somewhere you are safe. This may involve going to a relative or a friend's house if the rape took place in your own home and you no longer feel comfortable there. If you don't want to contact the police yet, or ever, Rape Crisis England and Wales suggests talking to someone you trust about what has happened. Telling someone does not mean you will have to make an official report to the police or tell anyone else. If you don't want to talk to someone you know, you can ring one of the UK's many rape and sexual assault helplines. Anyone aged 16 plus can contact Rape Crisis England and Wales 24/7 support line by calling 808 522 22 or starting an online chat. Trained staff will take your call, listen, and talk you through all of your options, whether you have decided to take further action or not. If you plan on going to the police, if possible, do not wash your clothes or shower, bathe, or brush your teeth. If you do get changed, keep the clothes you were wearing in a plastic bag. Try not to eat or drink either. These steps will help to preserve any DNA evidence your attacker may have left on your body or clothes. Get in touch with our news team by emailing us at webnews@metro.co.uk. For more stories like this, check our news page. Era. More, Claire's law was meant to protect women from abusive men, but has it worked? Era. More, bleeding eye virus Lassa fever could be in UK after case arrived from Nigeria. Era. More, Hosier and Annie Lennox give mind-blowing surprise performance at emotional fundraiser. Stay on top of the headlines with daily email updates. This site is protected by Ray CAPTCHA and the Google privacy policy and terms of service apply. Your information will be used in line with our privacy policy.